In dentistry, occlusion refers to the changing interrelationship between the upper and lower teeth. That is, the way the maxillary and mandibular teeth come together during movement and in full contact, as defined by Saltzman. Predental jaw relationships 0 to 6 months. Face and jaws. In a newborn, the face and jaws are positioned distally compared to the adult relationship. As feeding and muscle activity begin, functional changes drive growth. The face and jaws start to move forwards, downwards, and laterally, setting the stage for future occlusion. Gum pads. At birth, the alveolar ridges are called gum pads. They're firm, pink, and represent the early foundation for the developing dental arches. Maxillary gum pads. The maxillary gum pad has two parts, labiobuccal and lingual. The labiobuccal portion grows faster and is divided into 10 segments by transverse grooves, each representing a future deciduous tooth sac. The groove between the canine and the first molar segment is called the lateral sulcus, a key landmark. The lingual portion remains smooth throughout. The two parts are separated by the dental groove, which runs from the incisive papilla laterally, then distally and buccally toward the first molar crypt. The gingival groove marks the boundary between the gum pads and the palate. Mandibular gum pads. The lower gum pads are U-shaped and slightly everted at the front. Like the maxillary pads, they're divided into 10 segments, but these are less distinct. Relationship between maxillary and mandibular gum pads. The relationship of the gum pads at this stage is arbitrary. There's no fixed occlusal contact. The maxillary pad is wider than the mandibular one, showing complete overlap both anteriorly and posteriorly. The lower lateral sulcus lies slightly distal to the upper one. The upper lip appears short, and the tongue lies between the lips, maintaining space. A small vertical gap exists between the upper and lower lip pads in the anterior region. Growth changes. During the first year, gum pads grow rapidly, mainly in the transverse direction, and also posteriorly to make room for the developing first and second deciduous molars. During the predental stage, although there are no teeth yet, the gum pads and jaw relationships already begin shaping the foundation for future occlusion. Growth is guided by functional activity, setting the framework for how primary and later permanent teeth will align. Deciduous dentition period extends from 6 months to 6 years of age, a crucial phase in the development of occlusion. Let's start with the key points to be studied during this period. There are 3 major aspects we evaluate. Sequence of eruption, the order in which the primary teeth appear. Chronology of eruption, the specific timing of each tooth's emergence. Features of deciduous dentition, which include spaced or open dentition, closed dentition, deep overbite, overjet, and terminal plane relationship. Together, these help us assess the normal development and occlusal characteristics of the primary dentition. Now moving on to the sequence of eruption. Eruption of primary teeth begins around 6 to 7 months after birth, and a delay of 4 to 10 months is still considered within normal limits. Usually, mandibular teeth erupt before maxillary teeth. The typical order of eruption is central incisor, followed by lateral incisor, then first molar, canine, and finally the second molar. Next, let's look at the chronology of eruption, the average ages when each tooth appears. The lower central incisor erupts at around 7 months, the upper central incisor at 9 months, lateral incisors at 11 months, first molars at 15 months, canines at 18 months, and finally, the second molars erupt around 26 months. This eruption timeline is an important guide for tracking normal development and identifying any deviations early on. Features of deciduous dentition. Starting with spaced or open dentition, when interdental spaces are present between primary teeth, we call it spaced dentition. There are 2 types of spacing. Developmental or generalized spaces, which are seen throughout the arch due to antero-posterior jaw growth, about 4 millimeters in the maxilla and 3 millimeters in the mandible on average. Space dentition is actually desirable as it reduces the chances of crowding in the permanent dentition. Then we have primate spaces, also known as simian or anthropoid spaces. In the maxillary arch, they are located between the lateral incisor and the canine, and in the mandibular arch, between the canine and the first molar. These spaces play a key role in the early mesial shift during the transition to permanent teeth. Closed or non-spaced dentition, when no spacing is present between the primary teeth. This could result from wider primary teeth or reduced arch length, and it often indicates a higher risk of crowding in the permanent dentition. Deep bite. Initially, primary incisors show a deep overbite due to their vertical inclination, but over time, this deep bite reduces because of eruption of the primary molars and attrition of the incisors. By around 6 years of age, the bite often reaches an edge-to-edge relationship. Overjet, it's typically more pronounced in the early stages of primary dentition, but gradually decreases as the dental arches move forward. The average overjet is around 1 to 2 millimeters. Terminal plane relationship described by Baumi. It refers to the alignment of the distal surfaces of the upper and lower second primary molars. Baumi identified 3 types. Flush terminal plane, where the distal surfaces are in a straight line, seen in about 76% of cases. Mesial step, where the mandibular molar is ahead, seen in 14%. Distal step, where the mandibular molar is behind, seen in 10%. This relationship helps predict the molar alignment in the permanent dentition. Finally, let's summarize the general features of deciduous dentition. Dental arches are ovoid in shape. A deep bite is present initially but transitions to an edge-to-edge relation. Developmental spaces are common. Intercuspal contacts are shallow. Incisors are vertically inclined. The curve of SPE is relatively flat. Overjet is minimal, and there's no crowding under normal conditions. The mixed dentition period spans roughly from 6 to 12 years of age. This is a transitional phase, when both primary and permanent teeth coexist in the oral cavity. The mixed dentition period marks one of the most dynamic and significant stages in occlusal development. The transition from primary to permanent dentition begins at 6 years, with the eruption of the first permanent molars and permanent incisors. The mixed dentition phase is divided into 3 distinct periods. First transitional period, intertransitional period, and second transitional period. Let's begin with the eruption of the first permanent molar and the concept of the early mesial shift. In patients with spaced primary dentition and a flush terminal plane, when the permanent mandibular first molars erupt around 6 years of age, they utilize the primate space distal to the canines. As they move forward, the flush terminal plane transforms into a mesial step, allowing the maxillary first molars to erupt into a class 1 molar relationship. This process is known as the early mesial shift. However, in cases with closed dentition, this shift does not occur. Replacement of incisors and the concept of incisor liability. The permanent incisors are wider mesiodistally than the primary incisors they replace. As they erupt, they require additional space for alignment. The difference between the space required and the space available is called incisor liability, a term introduced by Warren Main in 1969. A favorable incisor liability exists in spaced or open dentition, while a closed dentition presents an unfavorable condition. On average, the incisor liability is 7.6 mm in the maxilla and 6 mm in the mandible. This discrepancy is compensated through 3 mechanisms. Increase in intercanine width. During eruption of permanent incisors, there's a 3 to 4 mm increase in arch width. Utilization of interdental spacing. Existing spaces, including primate spaces, accommodate the larger incisors. Labial eruption of permanent incisors. Since permanent incisors are more proclined, they occupy a wider arch form, providing additional room.